Tonight on Dr. Osborne's Zone, I sit down with Dr. Eric Osansky, and we talk about how he cured his hyperthyroid Graves' disease. And then we go on to discuss treatment options that are natural, that are safe, that you can implement, that can help you if you struggle with thyroid conditions like Graves or Hashimoto's. This is an interview you don't want to miss. We break down herbs that he took to alleviate his symptoms as he navigated his journey. We break down vitamins and minerals that are necessary to help support thyroid function. We talk about infections that can trigger thyroid disease and so much more. Again, not an episode you want to miss, especially if you struggle with thyroid disease. Stay tuned, and we'll be right back with Dr. Osansky. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over to Dr. Osborne's Zone. Dr. Osansky, thank you so much for joining me today on Dr. Osborne's Zone.
Dr. Osborne, thank you so much for having me. Really excited to have this conversation.
Yeah, I'd love to start the conversation by just, you may be spelling out or talking about your history. I know you've had your own personal experience and trials and tribulations with your own thyroid. Could you tell us a little bit about how that happened?
Yeah, so hard to believe it was 2008 when I was initially diagnosed with hyperthyroidism, and prior to that, I was just practicing just regular chiropractic, just had a very basic knowledge of thyroid health and really not a lot of knowledge with Graves, but I was trying to diet and detoxify. I was 182. My normal weight is like 165, 170. And so I was trying to shed a few pounds uh, and I was successful. Little did I know some of it was related to the hyperthyroidism, but I ended up dropping to 140 at one point. But I didn't know really, I didn't put the pieces together until one day I was walking around a retail store and they had one of those automated blood pressure machines. And I took my blood pressure, which was fine, but my resting heart rate was 90 beats per minute. And so I was thinking, well, maybe it's just because I'm walking around and that's increasing the heart rate. But the next few days I measured it on my own and it was anywhere between 90 and 110 beats per minute. And then I realized something was wrong, and that explained losing more weight than I intended, and went to see a primary care doctor. At that point, he just ran some basic tests, a TSH, a T4, and the TSH was depressed, the T4 was elevated, so he diagnosed me with hyperthyroidism, recommended a beta blocker, which I decided not to take, and we could talk more about that because there is a time and place for the medication, but. Then I saw an endocrinologist, got the official diagnosis of Graves, and as a chiropractor, like there's a lot of different options when it comes to continuing education credits, but I always took nutrition and functional medicine classes, and there were a few functional endocrinology seminars, and they focused, of course, more on Hashimoto's than on hyperthyroidism, but they did talk a little bit about hyperthyroidism and Graves, and that's when I realized that there were solutions. And this was prior to my Graves diagnosis. I didn't know that, honestly, at the time, I didn't know I would need it for myself. But after I was diagnosed, I looked back and I remembered, because it wasn't that long ago that I attended the seminars, thankfully. And so I figured I had nothing to lose by at least trying to address the cause of the problem. And there were some natural options other than the anti-thyroid medication, which is typically methimazole here in the United States. They were successful, and I'm grateful that I was able to improve my health, get my antibodies back to a normal level, of course, the thyroid hormones as well. And again, that was in 2008 when I was diagnosed, into 2009. And since then, I've been working with others with hyperthyroidism, Hashimoto's, more so hyperthyroidism, Graves' disease, due to my background.
So let me back up just a minute. So you had lost, you were 180, you said 182, and you went down to 140.
Yeah.
Um, common symptom of Graves, weight loss? Is that something somebody should look out for?
It is. I mean, not everybody. It's funny. There are some people who, for whatever reason, don't lose weight, but it is one of the classic symptoms. And not everybody who loses weight, it's not always as extreme as mine. They might lose 10, 15, 20 pounds, which is still a decent amount of weight. But yeah, if someone is experiencing unexplained weight loss, that could be a potential symptom of Graves.
And then you also mentioned your heart rate, your heart rate, your beats per minute was definitely elevated were you feeling your chest beating hard? Like were you getting palpitations or having like hot flashes or any other kinds of symptoms that, led you kind of down that road of getting that diagnosis?
Eventually, it's funny. Once I got the diagnosis, I noticed the palpitations at night. Not really hot flashes. Some people do have the hot flashes, heat intolerance. So with me, it was mainly the weight loss and increased appetite, but I attributed those symptoms to the dieting, detoxifying. And then the heart rate, I just didn't measure my heart rate, so I'm sure it was high during that before I measured it. Who knows how long it was high for? But yeah, once I got that diagnosis, I did notice at night, I started noticing heart palpitations, which is also a common symptom.
And what you mentioned your TSH being low, and you mentioned your T4 being high. Um, Obviously, two critical tests if you're looking to try to diagnose Graves. But what kinds of antibodies did you test positive for? Or were there other lab tests that that helped you in your journey on your diagnosis?
Yeah, great questions. So yeah, like initially I just got that TSH T4 because many endocrinologists won't look at a full thyroid or many medical doctors. The endocrinologist did the antibodies, but many medical doctors won't look at T3. But eventually I got free T3 tested, which was also elevated. And Antibody wise, so I had elevated thyroid stimulating immunoglobulins, which are more specific. They're a type of TSH receptor antibody, more specific to Graves. Uh, those, in my situation, those are the only antibodies that were positive. But working with people over the years, thyroid peroxidase or TPO antibodies are common in both Graves and Hashimoto's, more common in Hashimoto's, but a lot of people with Graves have those. But I was negative for those. And then thyroglobulin antibodies, which are more specific for Hashimoto's. Those also were negative in me. But again, a lot of people, I mean, it's not uncommon for people to have all three antibodies. I'd say probably like 20 to 30% of people I work with have all three. But in my situation, it was just the TSI.
So TSI. And so once you had your diagnosis, you were offered a beta blocker, you said, and then did they want to put you on the suppression drugs at all?
The endocrinologist did the medical. At first, when I saw the primary care doctor, he just recommended propranolol, which is a beta blocker, and then, yeah, the endocrinologist recommended methimazole, which I can sit, it's not like I completely dismissed, because again, this was all new to me. I didn't work with Graves patients at the time, but I learned about the herb bugleweed when I went through my continuing education and credits or seminars at the time. And yeah, again, I didn't know much about it, but I decided to give it a try. And then I also added the herb motherwort, which is kind of like a natural beta blocker to help with the cardiovascular symptoms. And in my situation, those worked wonderfully. But yeah, I was initially offered the anti-thyroid medication.
So just from your own personal desire to not take medicine, you used herbals as an alternative to control some of the symptoms. Is that fair to say?
Exactly. Yep.
Yeah, and then if we can fast forward a little bit through, beyond just using herbals, did you investigate or look for triggers as to why the Graves was happening in the first place? Like in your case, were there certain things you were eating or certain things you were doing that was driving this autoimmune process with your thyroid?
Yeah, and that actually, I didn't answer you mentioned some other testing that I did, in addition to thyroid. And so adrenal testing is something I did because the stress, I mean, I knew stress was a factor, but I was a little bit in denial. And, that I was I figured I was doing a good job of managing the stress. I knew stress was an issue, but I'm like, I think I'm okay managing it. But I just decided to do an adrenal saliva test because that was one of the tests I was familiar with, and everything was in the tank. Cortisol was low, DHEA was low, secretory IgA was low. And then looking back, I realized it wasn't just the emotional stressors, but when I was attempting to lose the weight, I was overtraining as well. I wasn't listening to my body. I mean, I wasn't running marathons, but I was at the gym just going all out. Just like when I was done, I was wiped out. And just I'm sure that also took its toll on the adrenal. So I think in my situation, stress was a big factor from, again, both emotional and the physical stressors. My gut health, I mentioned the secretory IgA was low, which also relates to stress too, but that, as you know, lines the mucosal surfaces of the body, including the GI tract. So I think in my case, the stress, having increased permeability of the gut, potentially were the two main factors in my situation.
Okay, so self-induced, like most men, right? We just push ourselves, whip ourselves like horses until we break,
There you
or
go.
until our
Yep.
wives scream at us enough to go and do something about it.
Yep.
Yeah. So you had a major levels of stress. You think those were triggers. What did your recovery look like? Because you're not. I mean, I don't know. Maybe you still are taking certain herbals, but are you in? Would you call yourself in remission at this point from Graves due to diet, lifestyle change, or other factors that you've implemented?
Yeah, I would. I mean, a common question people ask me is, am I still taking the bugleweed? Am I still taking the bugleweed and motherwort? I did take them for about 9 months, so I wasn't just on them for a month or two, but I haven't been on either of those, thankfully, since 2009. And I regularly test my thyroid, regularly test my antibodies, even though it was only my TSI that was positive. Every now and then I'll test the other antibodies too. And I've had some scares. I had COVID. In 2022, I had chronic Lyme disease and Bartonella diagnosis in 2018. So definitely those. I tested all the antibodies just to make sure that, which thankfully they were still in range. But yeah, so I haven't taken really anything anti-thyroid since then, since 2009.
Okay. So my own experience with Graves has largely been, I mean, I've not yet met a Graves patient who couldn't benefit from a gluten grain-free diet. Was that part of your journey? Was there gluten testing that you did that, led you down that road at all?
There wasn't, I mean, I eventually I did do a celiac panel, but at the time I didn't yeah, I didn't do any testing. I just knew even back then. I mean, obviously today it's all over. You want to avoid gluten with all different types of autoimmune conditions. But back then, there wasn't a. These days, there's like AIP diets, autoimmune paleo diets, which could be beneficial. Back then, there was similar diets like gut healing diets, and they still recommended to avoid common allergens of gluten and dairy. So yeah, I was gluten free and I was grain free at the time, which and now I recommend for everybody. I mean, even back then, once I restored my health and working with others, that was one of the requirements that people avoid gluten, avoid grains, for different reasons. Now, of course, you talk about in your book the impact of, not just the gluten and the other consequence of grains, but the mold. So I can't say I was familiar with the mycotoxins and the impact of mycotoxins on the grains. That's not why I have people avoid it, just really part of even a regular paleo diet, avoiding grains for other reasons because they can be harsh on the gut. We know that gluten can increase permeability in the gut, even those who don't test positive for gluten sensitivity. So giving you a long answer to your question, but yeah, I did avoid gluten and grains while I'm recovering.
So when you were recovering, what was that time frame like for you? You mentioned you got your diagnosis and then you took certain herbals for many months, 9 months. But what was the time frame like for you, to, where you felt like you were pretty well recovered?
Yeah, so I mean, 9 months, everything was looking great, but I didn't know if how stable things were. So even after that, it's not like I went from 9 months to just testing like once a year. Yeah, so I would do regular testing like every 6 weeks, and eventually every maybe 3 months. So I'd say maybe about a year or so, roughly a year, maybe a little bit longer, where I felt confident that, I was good to go. But, I don't know if you're ever really confident, or at least, I mean, at least the first year or two after. I mean, now it's been so long, and, even now I realize, hey, you never know. I could still relapse. It's not like it's impossible for me to relapse, but even like the first year or two, I guess I wasn't sure. But I guess really like the first like 12 to 15 months is like, after maybe 12, 15 months, it was like, okay, I think I'm going to be okay. Still want to monitor everything. And thankfully, again, it has stayed stable.
Did you ever go back to your endocrinologist and say, look what I did? Or was that just something you knew was probably a waste of breath and time?
No, I didn't. It's funny because my experience, I only saw the endocrinologist one time. I just went because I wasn't taking the medication. So I'm like, I can run my own lab. So I didn't really need to go see her. But, I hear so many nightmare stories from my patients on endocrinologists just saying that diet and lifestyle is a waste of time. When I saw the endocrinologist, I honestly didn't give her my background. I wanted to see what she told me just as a regular patient, and just so I actually didn't mention that I was a chiropractor and I was doing anything naturally. I just wanted to get the diagnosis, see what she said. And honestly, the one I saw, she seemed pretty nice. She wasn't pressuring me to get radioactive iodine or thyroid surgery, which a lot of endocrinologists do. She just said, let's take the medication, the methimazole, and see how you do. And like I said, I saw her that one time and that was it. But no, I never never did go back and say, hey, guess what? I didn't need to take the methimazole and I was able to get into remission naturally. So
So let's walk through. I mean, you had your successful journey, and it kind of sounds like that's what sparked you to want to help other people with the same condition. So walk us through, somebody comes into your practice and they're diagnosed with Graves' disease. What does a workup look like? What kinds of things are you measuring, monitoring? What kinds of changes do you find that are like the things that they absolutely must do in order to achieve a great degree of success? And I know that's a whole lot of things, but just let's just start with that conversation.
sure. Well, I mean, of course, we want to, well, first of all, we want to make sure they're safe from a symptom management perspective. We don't want someone to have elevated thyroid hormone levels while addressing the cause of the problem. I mean, sometimes it takes time to lower those, but we want to eat, if the person's taking anti-thyroid medication and they're tolerating the anti-thyroid medication and they're happy taking the anti-thyroid medication. My goal is not to tell them to switch to bugleweed necessarily, because I will say the herbs don't work for everyone. And so I just want to make sure they're safe. I mean, if someone's not taking anti-thyroid medication, of course, I'll recommend the bugleweed and the motherwort, and there's other natural agents that could be beneficial. If someone's taking the anti-thyroid medication and they want to switch, of course, I can't tell them to stop the medication, but I could give the recommendation for the herbs and just monitor the blood test, and under the guidance of their doctor, wean off the prescription. But yeah, so number one is just to make sure they're doing things to lower those thyroid hormones, because the elevated thyroid hormones could increase the heart rate, put stress on the heart, increase their bone turnover, so reducing bone density. And then we want to incorporate the foundations. Want to make sure that they are eating a whole healthy diet. And again, whether or not that's AIP for someone with Graves, or if they don't want to follow AIP, paleo is still pretty good, or modified paleo. But yeah, again, and as we discussed, definitely recommend to avoid common allergens, gluten, dairy. The grains, I mean, the nightshades are pretty common too. Yeah, so really just usually paleo or AIP is what I recommend for them to follow. And of course, managing stress, trying to get sufficient sleep, which could be a work in progress. And then yeah, testing. So I want to not only look at full thyroid panel with antibodies. Now, when I say full, there's also something called reverse T3, which is something I don't test for with hyperthyroidism, just because with reverse T3, that's the inactive form of thyroid hormone, and that seems like it blocks the entry of thyroid hormone into this, like it's just blocking the function of thyroid hormone and or thyroid hormone into the cell. And it's going to be elevated with hyperthyroidism. With Graves, we're going to have elevated reverse T3. So it's not really giving me much value. And I bring it up because if there's anybody listening who has Hashimoto's, maybe they, or if they work with Hashimoto's patients, they might test reverse T3 on everybody. And I do think in Hashimoto's, there's value with reverse T3, but not with Graves. I did want to mention that. But I recommend comprehensive blood testing, of course, a CBC, comprehensive metabolic panel, lipid panel, recommend a full iron panel, 25 hydroxy vitamin D, recommend B12, recommend, I mean, a whole lot of blood tests. So, and then, and then I do recommend some functional medicine testing. I usually do recommend some type of adrenal test, whether it's an adrenal saliva test like I got, or I'm sure you're familiar with dried urine testing like the Dutch test. It also looks at the hormones and how you metabolize the hormones. So some people I'll recommend Dutch testing. And then it depends on the person. Some people I will recommend a comprehensive stool panel, like a GI map or GIFX, just to see if they have things like H. pylori or parasites, markers of gut inflammation, opportunistic bacteria. Uh, you need a healthy gut, as you know, to have a healthy immune system, since most of the immune cells are in the gut. So again, if there's a lot of things going on in the gut, we definitely want to correct those imbalances. Sometimes we'll do organic acids testing. It really depends. I mean, I definitely like functional medicine testing, but I don't recommend like 5 or 6 tests for everybody. It really depends on the health history. That's the approach I've taken for years. And so yeah, we got the safe symptom management, incorporating the foundations, doing some functional medicine testing, and then based on the finding, I mean, I do give some initial supplement recommendations. Usually recommend like an omega-3 fatty acid because most people are deficient, but I do give them the option of testing for that if they want to see if they're like if they're not eating fish and they're not supplementing, they're almost always deficient in omega-3s and I mean, vitamin D, I find most people are deficient, but again, I do want to see the vitamin D test. Selenium is very helpful with autoimmune thyroid conditions, but again, we'll see what the testing show. If the adrenals if they look as bad as mine did, not only will I recommend blocking out time for stress management, but I might recommend some additional support. Like when my cortisol was low, I took licorice root to help. I took a B complex. Licorice root, if you have high blood pressure, you don't want to take. So if someone's listening to this, want to ideally work with someone. But um, yeah, and then if they have like something like H. pylori, I'll recommend a protocol. Again, of course, sometimes the mold and mycotoxins, other environmental toxins, which you can't test for all toxins out there, but you could test for some of them, like heavy metals and mold and mycotoxins. So if that's an issue, we'll put someone on a protocol and of course have them try to eliminate the source of the problem, whether it's the mold or other environmental toxins to the best of their ability. And yeah, so really it's just about, I mean, finding, removing triggers, healing the gut, incorporating those foundations, correcting nutrient deficiencies with any autoimmune condition. It's complex, but it beats the alternative, as you know, which is not just the anti-thyroid medication, but unfortunately, a lot of people do end up getting a thyroidectomy or getting radioactive iodine, which is ablating the thyroid gland.
Yeah. Yeah, well said. I think that's probably recommended way too often when it doesn't need to be. There's so many ways alternatively that can help people without going to such a radical procedure. Um, what would you say in your experience are the biggest mistakes people make? Like you just said a lot of different things like diet change, nutrition, looking for, microbial imbalances, looking at gut health, looking at hormones, but once you have all this data and you lay out a plan for somebody to follow, what do you see like is the biggest hurdle on average, where they're either not doing it right or they're not giving it enough attention and it's stopping their ability to progress in a beneficial way?
I mean, probably the stress. I mean, just everybody who fills out the health history, we do ask them to rate the stress levels and stress handling, which I know is not always easy to do, but I'd say probably like 70, 80% of the people will outright admit that stress is a factor. Yet it does seem for a lot of people to be a struggle to, just to block. And I recommend to start slow. Just take 5 minutes per day. I do like them to do something every day, not just like 2 or 3 days a week, but whether it's deep breathing, meditation, yoga, whatever they're willing to do, let's start with 5 minutes per day and get into the routine. And I mean, some people do a good job, but that's probably one of the biggest obstacles is just like after if someone's hitting that roadblock and not getting the progress. They might be following the dietary recommendations, but stress is a struggle. But diet also is a struggle too for some people. So after, again, there are some people that just will, I mean, I'm sure you see it at times as well, where someone after like a few months, they're like, oh, well, I'm 90% gluten free. And it's like, well, you really got to be 100% gluten free. Like even a small amount of gluten could be problematic. And again, maybe it's not the gluten, but other things that they're eating that they shouldn't be eating that could be affecting their recovery. And they might feel that, hey, even if it's every now and then, it's okay. And I mean, to be fair, it depends on the person. If someone's eating something else, again, gluten's a little bit different because it's highly inflammatory, but maybe there are other foods that aren't as bad for certain people. But again, it does depend on the person. But still, probably the two biggest struggles is following again, I would say stress number one, and then number two, following the diet. I mean, when it comes to like doing the testing, I mean, there are some people that procrastinate and put off the test, but most people are okay with doing the test. Most people are okay with taking supplements. Like it's making those diet and lifestyle changes that are challenging. And again, I've been through it, so I know it's not easy to do it. But yeah, so those like I said, those are probably the two biggest things, managing and that if I had to say a third, which I don't know if it's really affecting their recovery necessarily, but not taking the hyperthyroidism serious enough. And what I mean by that, again, some people they won't do enough to manage the symptoms. Although, my story again, I'm definitely not a big fan of the anti-thyroid medication, since I didn't take it. But if I had to take it, I would have taken it if the bugleweed, if the motherwort, if those things didn't work in managing my symptoms. So if someone there are some people that are so resistant to taking the medication. And again, I understand, it's anti-thyroid medication that comes with a lot of side effects. But there are some people that and if they have side effects, I could understand. And there's other alternatives too, like LDN. If someone has to, I mean, I don't know if you know this, but you're familiar with cholestyramine. I know, but the cholestyramine, there's been some studies, and I've actually had some patients that have taken it for hyperthyroidism because it could actually help in some cases. In the research, it says with mild hyperthyroidism, but I've had some people with more than like moderate hyperthyroidism. And again, it's not my first choice. Like I'd rather them take the natural approach. And again, it's not always easy to get a prescription for cholestyramine for hyperthyroidism. But I guess my point is there are alternatives, and you want to be safe. You don't want to go 6 months or a year with unmanaged hyperthyroidism, just because of some of the consequences I mentioned earlier.
Yeah, so the muscle wasting, bone loss, stress on the heart, risk
Yep.
of heart attack, other things. Um, Interesting about cholestyramine. I don't know. It's not anything I would have ever thought, but I could just speculate that maybe cholestyramine as a mold toxin binder because it has a high affinity for mycotoxins. Maybe those individuals that are benefiting from cholestyramine are actually in mold, and so pulling some of those toxins out of them is helpful. I don't know. That's just me speculating out loud.
Actually seems to it's at least the research doesn't talk about it talks about actually the effects of the cholestyramine directly on the thyroid hormone, so which is interesting. So it makes you think that if someone has Hashimoto's and if they, let's say if they're taking thyroid hormone replacement, they probably don't want to, I mean, you know this also, if someone's taking cholestyramine, you're supposed to take it away from
Yeah.
everything anyway, but if they're taking it with the thyroid hormone, it would bind to that. But yeah, it's I mean, that's I'm sure certainly affect as well. You know, a lot of people have moles, and that's definitely helping with the autoimmune response, which is responsible for the hyperthyroidism in those with Graves. But the research actually does show an effect on the thyroid hormones.
So in your experience clinically, you mentioned for you it took, you felt better after about a year. You didn't just at 9 months just, dive off the deep end and stop doing things. But is that probably the same time frame, or is that a similar time frame for the people that you see clinically? Is it a year? Is it 2 years before you really see antibodies come under control and symptom management part gets to go away and then they just get to live a healthy lifestyle?
Yeah, well, I should say, I mean, I felt better as far as symptom wise, I felt better pretty quickly. So was that like it was 9 months where everything was looking great, like the labs were looking good, the antibodies are normalizing. But I felt like when I took the bugleweed, I mean, within a few weeks, I knew that it was working. I was measuring my heart rate, and that was lowering, and I was still having palpitations, and that's when I added the motherwort, which helped with the palpitations. So yeah, I definitely felt better. Like it didn't take 9 months. I don't want people to think it's going to take like a year before they actually feel better. But as far as complete resolution of the symptoms and normalization of the labs, yeah, I would say, I mean, a good average is like 9 to 15 months. I mean, for some people, I mean, and every now and then there'll be someone who accomplishes it quicker, but more so it's on the longer side. Like I'd say, at least 9 to 12 months, but and some people it definitely does take over a year. Some people it takes longer than 15 months. So I mean, as long as you're seeing progress, I mean, that it shouldn't take a year before you see changes in the labs and start feeling better. But if you're, 80% better after 12 months, it makes sense to keep on going, to keep on and sometimes maybe you hit a roadblock with any other chronic condition, and maybe we need to do some retesting to see are we on track, or do maybe we need to do additional testing. But yeah, so on average, I'd say like that 9 to 15 month window.
Okay. Do you see a lot of people who swing from Graves to Hashis? Graves to Hashimoto's, like they start out with Graves, end up with Hashimoto's, or vice versa?
Yeah, I mean, I do see it. I mean, that's our goal. Like a lot of people have all three antibodies, as I said, like 20 to 30%. So many times we already know they have the Hashimoto's antibodies, and the goal by addressing the autoimmune response of Graves, we're also trying to obviously balance, like it's not like we're just focusing on the Graves antibodies, we're focusing on the whole immune system. So that obviously minimizes people switching from Graves, like becoming hyper and then eventually hypo. But if um if the autoimmune component isn't addressed, or if it's addressed, but again, if it's not helping, like what we're doing, if we're struggling to find the triggers and removing triggers, and yeah, I mean, definitely in the background, you could have damage to the immune system damaging the thyroid gland, even though someone's currently presenting as hyper, and then over time they could make that transition and eventually become hypo due to those the presence of those Hashimoto's antibodies. So yeah, I can't say I never see it, but again, and I'm sure the endocrinologists see it a lot because they're not doing anything for the immune system. All they do is put people on the anti-thyroid medication, and they even if you ask the endocrinologist, a lot of endocrinologists will say that the thyroid will burn out, which it doesn't actually burn. Like they almost give the impression that someone's hyper, and if they're hyper too long, it'll burn out. And I actually have a podcast episode talking about that. So I mean, it doesn't burn out the thyroid, but if someone has those antibodies for both Graves and Hashimoto's, and over a period of time, they're not doing anything to address the autoimmune component, there is a good chance that they will eventually become hypo. But that's why you want to do more than just manage the symptoms and address that autoimmune component.
Interesting that you say burnout because so many endocrinologists don't believe in adrenal burnout, but but talking about thyroid burnout, um, and just interesting for me. Let's shift gears a little bit. I know Graves is less common than Hashimoto's. What would you say that the underlying driving factors for Graves and Hashimoto's are the same, or would you say that you see certain patterns that are very different? What I mean, aside from the actual physiological manifestation of the disease, right? One's hyper, the other's hypo. Um, what do you find being the most common triggers in hypo and gray or in Hashimoto's?
Yeah, there's definitely overlap. I mean, stress is a big factor, I think, for both. For both Graves and Hashimoto's. Again, I mean, the four there. I didn't mention earlier, like four categories of triggers: food, stress, chemicals, infection. So those four categories, in general, apply to both Graves and Hashimoto's, as well as all autoimmune conditions. But and in the literature, there's definitely more with stress and Graves and stress with Hashimoto's. Um, but I do see it with both. I'd say H. pylori probably a little bit more common in those with Graves' disease from what I see. But again, it's not like I don't see it in Hashimoto's. And it's one of those things too. Sometimes it's hard to pinpoint the trigger because there's multiple things. There could be multiple triggers, and if someone has three or four different findings. Like, who knows if someone has compromised adrenals due to the stress, they have H. pylori, and then they let's say they do a urinary mycotoxin test, they have the mycotoxin. So I mean, again, all three of those could definitely be factors, and a good practitioner will address all three of those, not just say let's do one of those and see if you get in remission. So it's similar, but yeah, so I would say the biggest thing, as you mentioned earlier, just before, obviously the difference between in symptom management, hyper and hypo, as far as the triggers, there's definitely there's a good amount of overlap between the two. And to be fair, I see a lot more people with hyperthyroidism and Graves' disease. So there's especially over the last I don't know, I guess probably like last 6, 7 years. I don't want to say it's exclusive Graves because I do see some Hashimoto's patients, but it's been a lot more Graves than Hashimoto's. But of those that I do see with Hashimoto's, like I said, it is. I mean, I usually end up running similar tests. I can't say that there are certain tests I do more with Hashimoto's because certain triggers are more common than Graves. It's usually similar, like the adrenal type testing, the comprehensive stool panels in some people, and then some of the other ones I mentioned, organic acid tests, mycotoxins, really depends on the person. But yeah, so I can't, I mean, if you look at the literature, like Blastocystis hominis, which is a parasite, there are case studies showing that it could be a factor in Hashimoto's, and none showing that it could be a factor in Graves, even though I've had patients with parasites. And again, we address the parasites, but we're also doing other things too. So sometimes it's hard to say, is it the actual parasite? And then during the pandemic in 2020, and again, this is probably relates to my practice too, that there were a lot of people with Graves. So COVID seemed to be a greater trigger. And even in the literature, there's a lot more, it seems, with Graves and COVID than like Hashimoto's and COVID. But like Epstein-Barr is also like if you do a search in the literature for Epstein-Barr and Graves and Hashimoto's, I'd say it's pretty close, you see, with both of those. Um, and in that case, like Epstein-Barr, though, you can't get rid of Epstein-Barr. It's so to me, I look at it more as an immune system problem. You need to optimize immune system, live in harmony with the Epstein-Barr. So either way, whether it's a trigger or not, I guess I don't want to say it doesn't make a difference, but yeah. So to answer your question, like I said, there's a good amount of overlap in the literature. Will point to certain triggers maybe being more prominent in Hashimoto's and others being more prominent in Graves. I can't say there's anything overwhelming where it's like, yes, like mycotoxins are, like much more common in Hashimoto's and I will say H. pylori I do see more in Graves, but like I said, also these days it's more difficult to tell because I'm seeing probably like 80, 90% of my patient base consist of Graves, so it's definitely a smaller population of Hashimoto's patients.
Yeah, so you've got biased data just because of what you're seeing, I guess
Yeah.
is a good way to put it.
Yep.
You said four triggers, food, chemicals, stress, and infection were the things
Yes.
that you're kind of focused in on. So if you measure or assess those four areas for people, you find that as a general rule, if you address them simultaneously, these people have good outcomes.
Yeah, and there's, I mean, some will say nutrient deficiencies. Where are nutrient deficiencies? And I look at those at more like underlying imbalances. So it's, and same thing like gut healing. Like to me, like a leaky gut isn't really a trigger, but what like certain factors under those triggers can cause a leaky gut. But yeah, if you eliminate the food triggers, just do your best with the stress and trying to manage your stress, restore the health of the adrenals, and yeah, try to reduce your toxic burden the best that you can, and then yeah, any potential infections. Sometimes we have to live in harmony, like I said. Sometimes you can actually get rid of them. But yeah, I find when we address those four categories of triggers, do things to heal the gut, that yeah, people respond really well.
So in a nutshell, everybody's entitled to more than one problem. So you have to look at the potential for all those different things to be playing an interweaving role in why they develop their immune imbalance. I mean, would you say that autoimmunity as a whole it's the same, just manifests differently in different people? Some people manifest with Graves, some people manifest with Hashis, some people manifest with rheumatoid, etc.
I think it's fair to say there's that, I talk about that three-legged stool of autoimmunity, that autoimmune triad. There's the genetics, the triggers, and the leaky gut, the increased intestinal permeability. So yeah, I think it does make sense that there are some genetic factors that might determine why someone will have the antibodies for Graves, and others will have antibodies for Hashimoto's, and others will have antibodies for MS, and some people have multiple autoantibodies because of the genetics. But then, we know it's not just genetics because twin studies show that, like identical twins don't always develop the same autoimmune condition. So it's definitely environment plays a greater role. But yeah, I think that it is fair to say that that there's definitely similarities on why people develop different autoimmune conditions.
So going back to Hashimoto's, you had mentioned with Graves, you'd mentioned there were those two herbs, the bugleweed and the other that you found were helpful for at least symptomatically in the beginning, like just for helping control symptoms, so that they were safe as you were taking them through learning causation. Like, what are your triggers, right? Is there
Yes.
something that you do similar for people with Hashimoto's? Are there certain herbs or certain nutrients, certain glandulars that you're using just as a symptomatic improvement while you're navigating causation?
Yeah, I mean, there's no herbal replacement for thyroid hormone. So if someone, and again, it's not like I think everybody with Hashimoto's needs thyroid hormone replacement, but if someone does, they probably can't just take like ashwagandha or something that stimulates the HPT axis. They probably do need thyroid hormone. Now, could there be nutrient deficiencies responsible for lower thyroid hormone? Yeah, certainly. I mean, we could talk about the controversial iodine, but there's, iron, there's zinc that's important, and then there's certain nutrients important for the thyroid hormone receptor, like again, zinc again, vitamin A. So, I mean, we definitely want to make sure the person's not nutrient deficient, but if it's truly caused by Hashimoto's, again, the immune system damage in the thyroid gland, then again, correcting nutrients or giving herbs probably isn't going to help. So yeah, there are like glandulars that people could take if they don't want to take thyroid hormone replacements. I mean, if someone takes thyroid hormone replacements, I do prefer desiccated thyroid over Synthroid or other types of levothyroxine, synthetic T4. But there are like besides Armor and NP thyroid, which require prescription, there are over-the-counter glandulars. There's one called Thyrogold that people could just get without a prescription, and that has T4, T3, and it seems like it's good quality. Biotics Research has like GTA and GTA Forte, which from what I understand just has T3, doesn't have any T4 in there. So the active form of thyroid hormone. There are other companies that have glandulars. So yeah, so so there's not really an alternative, like whereas with Graves, bugleweed would be an alternative to the anti-thyroid medication, to the methimazole. The motherwort could be an alternative to the beta blocker. There's no herbal replacement for thyroid hormone if someone actually does need thyroid hormone. Again, I think too many people are put on thyroid hormone who don't need thyroid hormone, but some people do need thyroid hormone. And if they need it, then they need it. But yeah, there certainly are alternative options like desiccated by via prescription, or again, these other companies that I mentioned or other ones out there that have those thyroid glandulars.
You mentioned that you think too many people are on thyroid medication. Let's explore that. Um, are these individuals that are just doctors are just treating the lab and not treating the patient, or are they sometimes treating the patient and not looking at the lab? Like what do you see as faux pas there where people are getting too much, where they don't
Yeah,
maybe potentially don't need it?
yeah, I think the former is definitely true a lot, where they just look at the lab, they just run the TSH, and many times not even looking at the T4. So many times they're not even, a lot of people have Hashimoto's, they don't even know it because many times they're not even looking at the antibodies, but they just look at the TSH and they see TSH is high, and then they just put the person on thyroid hormone just based on that. They don't look at they don't look at the thyroid hormone levels, the T4, the T3. Um, maybe, and that's another flaw of not testing T3. Maybe they test T4, but some people, actually, a lot of people have problems converting T4 into T3. And so, what's affecting that conversion? Why? So, and giving more T4 is not going to correct that if someone has a problem converting T4 T3, and that's contributing to the high TSH, and then all they're given is synthetic T4, that's not going to help, and is why a lot of people feel lousy. So yeah, I think that's a big reason. Not so much the symptoms. I think most doctors will do some type of testing. Again, unfortunately, many times just the TSH, and that's usually what they use to determine thyroid hormone replacements. But yeah, that's all. I mean, like I said, there are people who definitely need it, and maybe some people need it temporarily and don't eventually need it permanently. But once someone is on it in the medical world, in conventional medicine, usually they're put on it and they're never taken off of it. And part of it is because a lot of those people do have Hashimoto's, and that obviously is progressing if you don't do anything for the immune system. So it will get worse. And then many of those people might be able to get off of thyroid hormone, where if the autoimmune component was addressed. Again, not everybody. There are people that still, even if the autoimmune component's addressed, they might need to take it. Um, but point is, many people are not given the chance to address it because they don't even know they have Hashimoto's. And then many who know they have Hashimoto's, they don't do anything anyway. They just say, okay, you have Hashimoto's. So all you need, you just take the thyroid hormone, and that's all they could do. I mean, that's all they're telling the patient. That's all that they can do for the Hashimoto's, is just take thyroid hormone replacement.
And that's forever, right? For the rest of your life.
I mean, usually when seeing a medical doctor, it is. I mean, there are exceptions, but most of the time, I mean, it's usually if you see a medical doctor or, an endocrinologist, so usually when they recommend thyroid hormone, they usually are giving it permanently. So yeah, very rarely do they say just let's take it for like 6 to 12 months and let's see, what everything looks like. They usually what they'll of course monitor the TSH, and that's again many times all they'll monitor. But yeah, I'd say most of the time when thyroid hormone replacements is given, it's usually intended to be a permanent treatment, a permanent replacement.
Okay. A couple of things I want to unpack from that. One would be what are the symptoms that you see when people are being medicated too aggressively, that with thyroid hormone medication? That's question one. And then question two, or what are the long-term consequences, even of taking thyroid hormone, just even if it's the right amount? Are there risk benefit things that people should be aware of and you know, be more cautious around these medications?
Yeah, so I mean, if someone takes too much thyroid hormone, it could be similar to having hyperthyroidism. If you're taking more than what you need, it could, in some cases, increase resting heart, like put some stress on the cardiovascular system, increase bones or decrease bone density, increase bone turnover, so cause some osteopenia, long-term osteoporosis. And there's even concern with normal thyroid hormone potentially doing that. Again, there's definitely some controversy over the studies and some, but there's some studies suggest just even taking regular thyroid hormone for like not regular, like normal, like just not excessive amounts of thyroid hormone, but let's say someone needs, like 75 micrograms and they truly need 75 micrograms of, again, we're talking about levothyroxine here. So if they're, again, normal amounts or even a lower amount, like 50 micrograms, and that's what they need over time can potentially have a negative effect on bone density. So, yeah, there are, and then obviously the big concern is not addressing the autoimmune component because again, 90% of people with hypothyroidism have Hashimoto's. So again, there's so many people on thyroid hormone where nothing's done for the immune system component. So for more damage takes place, and typically we'll see the person go from 75 micrograms to 100 micrograms, 100 micrograms to 125 micrograms. And I mean, not always quickly. It might take years, and some people might be on the same dose for quite a long time, but still, most of the time, they're eventually going to have to increase the thyroid hormone just because nothing's done for the autoimmune component. But yeah, like even normal amounts, potentially, like I said, the research, there's some conflicts, so I don't want to say definitively like everybody who's on Synthroid will get osteopenia, osteoporosis. I mean, you could do a DEXA scan, bone density scan, might not be a bad idea if you go into beyond thyroid hormone replacement, just to make sure. I mean, same thing if someone has hyperthyroidism, not a bad idea. I'm not a big fan of like scans and all that, but with low bone density, you don't know, and oftentimes until you fall and get a fracture. So you could certainly like do a test, see if you're lower in bone density. But yeah, that's those are some of the potential concerns with being on thyroid hormone replacement for a long time.
Do you look for a specific range with your own patients? Like I know TSH is the primary monitoring tool for most, and I know you're doing more than that. But do you look for TSH to be at a certain level, and just in your experience of this is a better place than say you know for me I look for point 0.5. If it's below that, I start having that concern. If it's really above 4, I start having a concern. So what are the numbers you're looking at?
Yeah, I mean, I agree if it's, but yeah, if it's too low, like below zero point 0.5, but I'd say a sweet spot is like between 1 and 1.5. I mean, even if it's 1 and 2, between 1 and 2, I'm okay. But, if it's above 2, I mean, we can make the argument everybody's different. And if everything else looks great, maybe it's okay. Most functional medicine practitioners don't like to see it above 3, and definitely yeah, above 4 is like a real big red flag. But I'd say 1 to 1.5, 1 to 2, between 1 to 2 even is okay. And then I could even say like for T4 and T3, at least in the United States, with most labs like LabCorp, Quest Diagnostics, I like to see free T4 between 1 and 1.5, free T3 between 3 and 3.5. And again, a lot of times we see them on the lower side. They're within the range, the lab range, like T3. So many times I'll see T3 like 2.2, 2.3, which many labs that's within the range, but it's on that lower end. And again, if someone has a normal T4, maybe their T4 is 1.2, which is good, but their T3 is 2.3. And again, if most medical doctors won't test the T3 to begin with, but if they do, they would look at it and say, "Oh yeah, you look okay." But that clearly shows there's something going on, probably a conversion problem. And if anything, the person might need some T3. Again, like I'm a bigger fan of the desiccated thyroid if they need it, but if someone's going to be on the synthetic T4, and if they have the low T3 as well, at the very least, maybe give them like some Cytomel, a small amount of T3 to help with that lower T3. But again, many will just keep on giving the T4. But those, yeah, those would be my optimal ranges for those labs.
And where do you fall on lab testing if somebody is on medication? Do you test them fasted without the medicine? Do you test them with the medicine? Where do you fall in that regard?
Yeah, it's typically fasting. That's typically what I recommend. Just not take the medication before doing the blood draw.
Yeah, I've seen people do it, doctors do it both ways, and
Yeah.
yeah, yeah,
I mean, I would say at the very least, though, you want to be consistent. If you
yeah, yeah, yeah.
if you're gonna yeah, like do it fasting all the time, and preferably like the same similar time of day. Like so if you're gonna do it morning fasting, always do it morning fasting. If you're gonna do it not fasting, like early afternoon, maybe again, it doesn't have to be exactly the same time, but I would say, still you probably want to be consistent sort of when you're doing the labs.
Okay. Well, what did I not ask you? Is there anything that you feel like um, needs to be shared for that average person navigating either Graves or Hashimoto's that we haven't really discussed or talked about that they could walk away from this conversation, with a better knowledge to move forward and get healthy?
I mean, you covered a lot. I mean, the one thing that, I don't want to open up a can of worms, but I know there's still a lot of controversy with iodine and thyroid. Just there's practitioners, and again, I'm not against iodine. I've had good experience with iodine, like, but it's again like iodine, you need iodine for thyroid hormone formation, and it has other good health benefits, but high dose iodine could be problematic for some people. And there are some people that I've seen more so with hyperthyroidism and Graves that were doing the high dose iodine. And it seems like that might have been at least, I don't want to say trigger, but at least like straw that broke the camel's back. Like it was like a factor. And when I dealt with Graves, when I was dealing with Graves, back then, again, 2008, 2009, I like high dose iodine was more in favor. And so even the seminars that I attended were teaching, hey, if you have Graves or Hashimoto's, like you want to make sure you have sufficient iodine and recommending separate iodine supplementation and just realize even though I had a good experience with iodine, I've seen other people have problems with iodine. Again, if you have iodine deficiency, yes, it can cause like a goiter, swelling of the thyroid, yes, but it could also, in some cases, exacerbate hyperthyroidism. In some cases, it could exacerbate the autoimmune response. Again, I'm not talking about like iodine in a multi or, having like some food sources of iodine. Although if someone's eating a lot of sea vegetables, like massive amounts of iodine in food, maybe it could, in some people, cause issues. But so yeah, I guess just that's one thing maybe to bring up is that you just want to be careful. Like if you're thinking about supplementing like separately with iodine, maybe you want to work with a practitioner who has experience working with thyroid conditions, just because, again, it might not be even work with a practitioner. They might tell you it's not a good fit for you, but you definitely don't want to just randomly start taking high amounts of iodine. Some people will look at the blood testing for iodine, which really isn't accurate. So yeah, I guess that was one topic that's worth bringing up, just because I've seen some people run into trouble with taking higher dose iodine supplementation.
No, I love it. I've seen the same thing. I'm for it, and I'm against it for some, right? So
Yeah.
I think ultimately it's always biochemical individuality, in my experience, that wins. You mentioned serum testing not being super accurate. What do you test for iodine? I like iodine loading. I also like INA, intracellular nutrient assessment or analysis. What are you looking at iodine on? Under what
Y-
lens?
I like urine. So yeah, I like urine testing. I mean, I've done myself the iodine loading test. Again, some people you want to be careful because you do got to take the iodine prior to that. So there's that option. There's a urinary iodine test. There's a company, Hakala Labs, that does both. They offer the iodine spot test, and they also offer or the loading test. So yeah, I do prefer that the urinary testing over the blood testing. What's the other? Well, you mentioned another type of iodine testing.
Yeah, intracellular. It's a lymphocyte proliferation test where they're measuring iodine stimulation of lymphocytes and looking at growth rates above the baseline. So if somebody has, baseline growth rate of a white blood cell that improves dramatically after adding iodine, you get a
Oh,
percentage
interesting.
growth rate back. And so, we see a lot of people where, 120% improvement in cell function growth rate after adding iodine to their
Hmm.
lymphocytes. And then we've had really good success looking at it that way and then making that as a decision for supplementation. I like
Yeah.
iodine
I'll need,
loading. I love, the iodine loading. I've had, probably one of the premier docs in that realm is Dr. Fletch's,
Mhm.
if you've read his work. But yeah, I had a conversation with him years ago. We were running a ton of these tests and had some really rare findings. And I felt an honor to have a conversation with the guy because he was very brilliant. But um, I like that test too. And oftentimes I'll run them in tandem if we've got a really big issue and we're really trying to dial it in. But those are my favorite anyway, for what it's worth.
I'll need to find out because I'm honestly not familiar with that other test that you mentioned. So I'll need to maybe look into that. So
Yeah, I'll connect
sounds
you with
cool.
it. What do you think about iodine and TSH? So can we talk a little bit about that since we've opened the iodine can of worms? Talk about iodine's impact on TSH as a blood marker.
Yeah, I mean, and again, it does vary depending on the person. That's the thing. It's like, iodine, if you take iodine, if you just take regular iodine, just like iodine in a multivitamin, it's probably gonna have like minimal impact. I mean, if someone's deficient in iodine, and they're hypo, because we've been focusing more on hypothyroid, I'm sorry, we've been focusing more on Hashimoto's, the autoimmunity component of of hyperthyroidism and as far as Graves and then Hashimoto's for hypothyroidism. But if someone, and I don't know if this is the response you're looking for, but obviously, again, if someone, iodine is important for thyroid hormone formation, and so if someone is iodine deficient, that could cause increase in TSH. So that could be a factor would increase TSH. Um, but it also, and you probably know this too, like it's in so thinking about that, if you take too much iodine, you could say, well, maybe that also can cause not hyperthyroidism because again, it's important for thyroid hormone formation, um, but also in some cases, high dose iodine could help with hyperthyroidism. That's like the dilemma. It's like it could worsen things, but in the past, before radioactive iodine, some doctors actually used higher dose iodine to help, to having a kind of like a negative feedback to suppress thyroid hormone formation, and again, which would result in that increase in TSH. So, so typically, yeah, like typically it will help in the case of hypothyroidism, it would help to lower the TSH if someone has a high TSH due to iodine deficiency. But if someone, like I said, in that other case, where if someone has hyperthyroidism, which typically presents with depressed TSH, and they're taking high dose iodine, they could have the opposite effect and actually increase TSH. So,
And that what I was mainly what I no that I like that you expanded on that. What I was trying to get at too was just the fact that some people who are low thyroid, hypo, if they take high doses of iodine, how it artificially elevates their TSH
yeah,
level and gives the
yeah.
doctor kind of a false impression. Because I've seen that where people have been diagnosed because they were supplementing and they didn't think to tell their doctor or they didn't realize that it would cause, artificial rate
That's a
rises
good
in
point.
TSH.
Yeah. And Brownstein brings that up in his book, Iodine, Why You Need It, Why You can't live without it. Dr. Brownstein talks about that. Yeah, so you're right. That's a good point, because getting to our early conversation about them just get those who don't test the antibodies and just looking at TSH and saying, okay, your TSH is high, let's give someone thyroid hormone replacements, and then not giving, I mean, because let's face it, most are not asking, are you supplementing with iodine, let alone in high doses? So they're just giving the thyroid hormone replacement, and the person might not know any better, and just, yeah, so that's actually a really, really good point that you brought up with that as well.
So now that we've tapped out on the iodine, anything else that you can think of that that we should bring to the audience's attention that we haven't really talked about, or that you think might give them some valuable to take away?
Yeah, okay, I'll do one more thing, and then I don't want to keep you too long, but in Graves, there's also thyroid eye disease, which is more of an immune system condition than an eye condition that involves the same autoimmune component, like the same antibodies. And I think it's important to bring it up, because over the years I had a few patients who had Graves diagnosed not because of the elevation in heart rate like I had, or palpitations or weight loss, but they started having eye symptoms, and like eye bulging, eye pressure, and then they ended up going to an eye specialist, like an ophthalmologist, and then were told that it was thyroid eye disease, and then eventually got the the lab. So it was so yeah, so that's I guess the one other thing that we didn't cover when it comes to Graves is thyroid eye disease is common. Usually it's more mild, but sometimes it could be more moderate to severe. And when someone has thyroid eye disease, there are natural options too. It really comes down to addressing the autoimmune component.
Okay, so
Yeah,
you're talking about the bug eyes, the when
you
people
got
really
it. Yeah.
develop the bulging eyes. Yeah.
Yes. Yep.
Um, so where can people find you if we want to send people your way? What's a good place to go learn more about Dr. Osansky and his life and practice and everything else?
Yeah, so it's funny, it's 2010, a year after I dealt with 2008, 2009 is when I dealt with it. 2010, I created the website Natural Endocrine Solutions, where I have a lot of articles and blog posts on both hyperthyroidism and Hashimoto's. And then 2021, I came out with the Save My Thyroid podcast. And I'm like, you know what? SaveMyThyroid.com is a lot easier to remember than naturalendocrinesolutions.com. So I have two websites. So SaveMyThyroid.com, you could find my podcast, naturalendocrinesolutions.com, where again you can find the articles. And then also I have a community for Graves called the Healing Graves Naturally community, which people could check out by visiting savemythyroid.com/heal Graves disease. And then I have three books, two of them on hyperthyroidism, one of them on Hashimoto's, and you could find those on Amazon.
Fantastic. Yeah, we'll put some links below for those who want to check you out, can go
Thank
and
you.
learn some more.
Wonderful.
Well, Dr. Osansky, thank you. This has been a great conversation. I really do appreciate your time today and sharing so freely and so openly both your personal experience, but also, your clinical experience. It's invaluable, and I think a lot of people are going to walk away from this with some contextual knowledge that might help change and save their own lives.
Yeah, I hope so. Again, there's a lot of people out there with these conditions, and yeah, the one thing, there's hope. So definitely hope to restore your health. And thank you. Thanks, Dr. Osborne. It was great having this conversation, and appreciate you having me.
Thanks so much for tuning in to Dr. Osborne's Zone. If you found this information helpful, you'll also want to check out my complete nutritional crash course on the thyroid right here. And if you want to see more fantastic podcast episodes of Dr. Osborne's Zone, check out our playlist right here. And if you're new to the channel, hit that subscribe button, hit like, hit share. Know that our mission is to save 100 million lives, and we can't do that without your support. Let's get this information out into the hands of people who need it the most. And as well, come visit me at glutenfreesociety.org. That's our hub. If you're looking for fantastic nutritional supplements and additional information on diet and lifestyle changes that you can use to navigate autoimmune disease so that you can live a healthier, happier life. Thanks so much, and we'll see you Thursday for our live Q&A.